Good morning, everybody. Thank you for heeding our advice. We had testing numbers over 8,100 again yesterday, but we did have 6 additional cases, half of which are from a known source and half of which we understand at this stage could be from community to community transmission. This again states how vigilant all of us need to be, especially from Friday when restrictions are eased, and it's really, really important for all of us to take that extra precaution, as we know there will be many more people out and about, and many more people out and about for recreation as opposed to other reasons. That is a big shift in the way in which we're managing the pandemic, a big shift in the way in which people can have that extra bit of freedom. Whilst we welcome that and are grateful that we're at this stage to be able to do that, those high rates of testing will ensure we can protect the community as much as possible and make sure we can also focus on those parts of the community where we really want to open up business and get those jobs going. We need to be in a position to do that, and therefore it's so important for all of us to come forward and get tested, even if we have the mildest symptoms. And I was very pleased to have brought to my attention a number of international reports which have said that New South Wales has the highest rate of testing in the world. It's something we're incredibly proud of, something we need to maintain. And I always say to our experts and my team here in New South Wales that there's no reason why we can't also lead the world in the way that we deal with the pandemic moving forward, in the way in which we give the good advice to our citizens which keeps us all safe, but also look at parts of our community, parts of business in particular, that we can activate without having any adverse impacts on health. We know, though, that from Friday we'll be analysing the data very closely, because we appreciate once you ease any restriction, there's more activity, there's more chance of people getting the virus or passing it on to others. And we also know, given how good the return of schools has been to date, I know it's only day 3, but the feedback we've had so far has been very positive, and we anticipate that after next week there is a strong chance that the vast majority of students will be back to face-to-face full-time learning, but that is something the Education Minister and I will update everybody on next week. It is really important for us, again, to maintain that vigilance, to come forward and get tested. But meanwhile, whilst the restrictions were in place, I was able to advise the community that we were making sure that we were increasing our capacity in the health system, and I'm very pleased to announce today, and the Health Minister will outline in greater detail, but we've invested millions of dollars to refresh the skills of 1,500 nurses so that they can have intensive care training. So in addition to our intensive care nurse workforce, we now have an additional 1,500 nurses from around the state that have been given a refresher course to make sure that if we need to call upon them, they are willing and able to assist us in dealing with those intensive care patients. At the moment, the number of people in intensive care, especially with COVID, is very low. And of course, that's what we'd like to keep it. But we know that's not going to be the case. Once we ease restrictions, it definitely won't be the case. But if you look around the world, many communities who are easing restrictions aren't in the position New South Wales is in. Many communities around the world who are easing restrictions still have case numbers in the hundreds every day, which would have been untenable for us, because that would have meant thousands of people would have been in ICUs. It would have been an untenable situation. So we should feel very fortunate that we're in a position, as we're easing restrictions, to have the case numbers where there are. It does give us more options, but it also means we have to maintain our vigilance. We have to get tested if we have the mildest symptoms. We have to stay home if we're worried we've been in contact with somebody, and we need to take every precaution. And I can't stress enough that when you're with people you know very well, even if you're outdoors, you tend to forget sometimes. You tend to forget you have to socially distance. We can't let that happen. Even if you're people who are very familiar to you, inside the household it's fine, but outside your own household, outside with the people you live with, even if they're members of your extended family or they're very close friends, don't think that you can't pass the virus to each other. Please be careful. The last thing any of us want is to either contract or give the virus to those that are closest to us. But again, thank you to New South Wales for really being on the journey together. It's because of the goodwill of the community that we've all been able to get this great result. But again, our success won't be measured by the number of cases we get every day. Our success will be measured equally by how many people keep their jobs, by how many people don't feel that stress and experience that diminishing quality of life that so many have in the past few weeks. And we certainly want to focus on people having job security and people having that good quality of life moving forward, and that's what easing the restrictions is all about. I'll ask Dr. Chant now to give some more detail about the medical report overnight, and then the Minister for Health will provide further detail on our announcement about retraining those great nurses for ICU.
There were 6 additional cases in the 24 hours to 8 p.m. on the 12th of May. This brings the total to 3,059 cases. 8,117 people were tested. 2,571 people have recovered from their COVID-19 infection in New South Wales. There was 1 death in the reporting period, bringing the total deaths to 47 overall, and that death related to an 81-year-old woman who had been confirmed to have COVID, and she was a passenger from the Ruby Princess cruise ship that disembarked on the 19th of March. In relation to the 6 cases, we have 2 close contacts of nurses, a nurse from the Newmarch facility where there was a PPE breach for that nurses who's acquired the infection through that mechanism, and then there were 2 close contacts who had also worked in the facility, but that was linked as the exposure, that contact with that nurse. They were in isolation, developed symptoms and were tested, so there was no issues around ongoing transmission related to those healthcare workers. In relation to 2 other cases were related to cases that had occurred about a week ago, where they again had been treated as confirmed cases, but the testing was inconclusive, and that those cases have subsequently, through genetic sequencing of the virus, confirmed as cases. Those cases occurred in the Sutherland Cronulla area, but there's been quite widespread testing and no other cases identified in that area. There's 1 case that remains under investigation, and the 6th case was overseas acquired. So I'd just like to reinforce the Premier's urge for everyone to continue to come forward for testing. Maintaining these high testing rates gives us that assurance that we are on top of any community transmission as it emerges. I would also like to just emphasise again the importance of those social distancing measures, but also combined with those hygiene measures of washing your hands, not going out or not going to workplaces if you have the most minimal of symptoms. Thank you.
Thanks very much, Kerry. Look, as we progress towards Friday and stage 1 and a relaxation of the very strict requirements we've had to keep people safe here in New South Wales, I just want to emphasise that the entire health system continues to prepare for what could still come. I fear that some people in our community now think that because we're doing so well that this is the end of it. Well, quite possibly it's not. We have seen overseas what can happen when complacency sets in. In some jurisdictions, complacency was there right from the word go. As the Premier noted, New South Wales, indeed Australia, has done extraordinarily well and has been recognised by overseas authorities as to the fact that we are amongst the leaders in the world in terms of how we've managed this situation. Here in New South Wales, our entire health system continues to build, and I thank the Treasurer for all of the money that he has put into the New South Wales health system. Obviously, taxpayers have contributed very substantially to what we are seeing. We've already had a doubling of our ventilators. We're heading to increase those numbers still more dramatically in the next few months. So our preparation as a system, as a government, is continuing. Part of that preparation is that we have to have more staff available to look after people in the intensive care units across our hospitals, across our entire state. We have, in normal circumstances, we have a high level of staff anyway, but this is not normal times. This is definitely not normal times. So what we have done is the entire health system has gone about trying to upskill nurses and doctors who might not normally work in an intensive care unit. So there have already been 1,500 staff who have actually retrained and learnt the very high-level skills that are necessary to operate in an intensive care unit. And they are quite different skills. I know talking to nurses who've worked in theatres and other highly specialised areas have emphasised that their specialties don't necessarily automatically transfer to the very particular specialised nature of an intensive care unit. So our government has supported the health system, and I thank the government more broadly for supporting our health system. And I know the nurses who have actually undertaken that training have reported that they feel a lot more equipped and therefore a lot more relaxed about the issues that they may still face. Obviously, nurses, doctors, allied health staff are very, very happy that at the moment we have managed through our management and the community's willingness to be partners in this process, we have managed to keep the numbers down. But we all recognise, and certainly the health staff recognise, that the dangers are still lurking. This virus is amongst the community. We know it's out there somewhere. We also know that it could at any time flare up. We've seen clusters in particular areas that can still occur. So we hope it won't, but while it's hopefully at a lower level, at least in terms of the positive numbers we've seen, we will still continue the preparation. And I thank all of those nursing staff who've so willingly stepped up to the task to take on what is really an extra skill set to be able to make sure our community stay safe.
How many of those additional, the 1,500 nurses that have undertaken the ICU training were outside of Sydney and regional areas?
The entire state has had this training program. It's not just, we've got 15 local health districts across New South Wales, and we have major hospitals and smaller hospitals all across the state, and it's been distributed right across the state. Certainly, I think there's been more in some of the major hospitals where people would be more likely to be transferred, but it's been right across.
Premier, how upsetting is it to hear that even after all these weeks we're still losing people from the Ruby Princess debacle?
Oh, look, I think it's upsetting to know that people are still perishing and dying from this horrible virus. And we can't imagine what families are going through, and that's why we've worked very hard in New South Wales to try and reduce that distress that families are experiencing. But please know that if a loved one of yours or in fact yourself succumbs to the virus, that we have a health system ready and waiting to take care of you. And that is important because so many countries, so many people around the world can't even get access to the medical treatment they need. And I appreciate how distressing it is for families who live in fear that a loved one will get the disease, or in fact a loved one who gets very seriously ill from the disease. But please know that in New South Wales we have our system ready to assist, ready to take care of people, and unfortunately that's not something that exists in other parts of the world, even in countries that have traditionally been affluent, countries that have traditionally been able to take care of their citizens are not in a position now to do that. And therefore I'm grateful to the experts, I'm grateful to the system that's allowed us to manage the pandemic in this way.
You've mentioned several times that you do expect the number of cases to increase as restrictions are eased. Do you have any modelling to suggest how many people could end up in intensive care?
We don't yet, because it will be based on the level of activity that increases because of the easing of restrictions. So obviously schools have gone partially back this week and next week, and that'll be inputted into the data, into the modelling. We also know that from Friday there'll be an impact. So the next 10 days for us are quite critical in looking at what the data is telling us about activity. And even when we announced the restrictions before they actually came into effect, it does give people more confidence to move around. So you automatically see the strength of people listening and activity increasing. Even when we said it was okay for retail shops to open if they followed the health rules, even before the easing of restrictions, we noticed that activity increase. So we appreciate that from Friday onwards we have to pay extra attention to the data and to the modelling, and all that level of activity, whether it's use of e-tags or transport, or whether it's people at workplaces, or whether it's general activity, we can measure through a variety of sources, and we'll take that into consideration as we're looking on the path forward for New South Wales.
Since you first started easing restrictions, the two adults visiting another home, for instance, there hasn't been a noticeable increase in cases, has there?
Well, there's been an increase in activity, and fortunately it hasn't translated into more cases, which is a good thing. But obviously once you increase the number of people that can get together, whether it's indoors or outdoors, once you increase the things people can do, and we've had a seismic shift in the message we're giving, because prior to now we said you can't leave home except if it's under a general category, one of the 4 categories. And now we've said it's okay to leave home for recreation, and that's a big change. We know people will welcome that because it gives everybody more freedom, but it also brings more risk in terms of the number of cases. But we have to keep moving forward. We have to accept that a manageable number of cases will allow us to have people keep their jobs. We don't want to see more people go into distress because they can't keep their job. And we also need to think about how our economy comes back in some form whilst maintaining the overall health of our citizens. And that's the tough balance that all governments are grappling with. But in New South Wales, we feel quite armed with options before us because we have done well with a population of our size, and with the number of cases we had, that dramatic decline tells us we have the ability to push a bit harder perhaps in opening up parts of our economy, but doing it in a responsible way that gets those jobs back but also keeps the citizens safe.
Premier, can I ask a question yourself and Dr. Chant? Can you explain the health advice that says why pubs can't open their restaurants? I mean, you said yesterday they won't be able to do that, but why not shut off the bar and let them have their tables to serve food? And in particular in regional communities when this may be the only restaurant in town.
Yeah. Well, actually, Dr. Chan, I hope I'm not giving too much away. Dr. Chan and I actually discussed that this morning. So we're looking at opportunities in New South Wales where we might be able to do that. So we'll be talking to industry. I've already been in touch with the Treasurer this morning as well on that topic. So if the health advice supports it in certain circumstances, we'll be happy to proceed on that basis. Please know now that New South Wales is in a position where we can assess what parts of our economy we need to get going, what businesses we can support, and we are very much in that phase of looking at providing that certainty and those opportunities. And the Treasurer, Dr. Chant, myself and our team will be working closely with industry to see what opportunities we have to get jobs back.
From Friday?
I'm sorry? No, it's unlikely to be. I mean, I don't want to preempt what the advice is. I don't want to preempt the discussions we have. But it's also the case of perhaps the industry, and again, I don't want to preempt discussions we're having, but obviously the industry will also tell us what their preference is on what is a good plan moving forward and what will make things viable. And we're working with all peak bodies. Any organisation, any peak body that wants to come to us to talk through what they envision their path back, we are ready and willing to listen and ready and willing to have our health experts have input into that process.
What is the advice now for precluding
I'm
them
sorry?
from opening on Friday?
I'm sorry?
What is the advice
At this
precluding them
stage,
from opening on Friday?
it's just cafes and restaurants. But as Dr. McAnulty explained yesterday, and I'll ask Dr. Chant to explain this as well, but the health advice to date has been that obviously sitting down and having a meal and exercising social distancing is different to people having a drink or otherwise at a pub. However, we are looking at opportunities where there are those venues within a pub situation or a club situation where it's sit down only, that we can consider that as well. But we would rather engage with industry first before we made any announcement about that.
Can you indicate how soon that might be? Some
sorry?
country pubs are saying they're not going to last until July when it was initially indicated that pubs would open. Can you indicate how soon an exemption might be?
Well, that's why, given that time frame and given what the industry has been telling us, we've already engaged discussions with them. So it's about making sure that we have the robust health advice and then how we apply that to public policy. And so that's the pathway we're looking forward to resolving in the near future.
Meat imports from 4 abattoirs in Australia. One of those is in Casino in northern New South Wales. Are you concerned about this and the effect that it might have on the local community?
Look, you always worry about any decision which impacts local jobs and local communities, but fortunately Foreign Affairs is not an issue that I have to worry about. However, I will say this, New South Wales has always maintained our government-to-government and business-to-business relationships in the benefit of our citizens, and that will be our policy moving forward.
So is there anything that you can do to sort of rectify this issue in any way?
Oh, well, as I said, fortunately we don't have responsibility in Foreign Affairs, but New South Wales has always had strong relationships with our sister cities around the world. We've had strong business-to-business relationships within companies around the world, and that continues because we tend to proceed on the basis of those existing government-to-government and business-to-business relationships, and that will continue as far as New South Wales is concerned.
Sorry, just one more for the Premier. How concerning is it that there clearly may not have been enough training for PPE usage in Newmarch House, given that there was a serious breach that's now led to another 2 cases?
Oh, that's something I'll ask Dr. Chan to talk about.
So, Dr. Chan, has there been enough training in Newmarch on PPE usage?
So the advice I've got in relation to that case is that the healthcare worker was actually assisting someone and it was dislodged by the resident inadvertently. the process of rendering assistance. And I've explained to you that there are many aspects of delivering care, which particularly in settings where despite all the controls, we've got humans interacting with humans and issues can happen. I've indicated before that I acknowledge the fact that we need to have quite strong training. We've been talking about that for many, many months, and I'm very pleased to say that our Clinical Excellence Commission has supported our health system to be well trained in relation to PPE, but it is something that we need to be incredibly vigilant, particularly in an outbreak setting.
And just in regards to the Ruby passenger,
Sounds like she put up a good fight. It's been a long time since they got off that ship. Can you give us any detail? Where was she? Was she in hospital, in ICU, or?
I think it's, look, before commenting, I think this is a time that my wishes go back to the family, my condolences to the family. Before releasing any additional information, the process I would have is just ascertaining that the family is comfortable with any additional information we release.
When did this passenger, Dr. Chan, when did this passenger contract the disease? Can you say that?
This person was a passenger on the Ruby Princess, and so, as I've said from the outset, the exposure was on the cruise ship.
Sorry, when did you test positive though?
I haven't got that information with me, and I'll follow up with that.
There's a new illness that children seem to be developing in the wake of being COVID positive. It's obviously highly concerning. It's caused deaths in the US. Is that the realisation of that illness changing the way we treat children in New South Wales? If, for example, is it changing the approach towards children going back to school, given there could be now extra concern that children could spread the virus and get it?
We are continuing, as I've indicated, to review the evidence. This recognition of this syndrome does not at this stage change any of our health advice about going back to school. The paediatric inflammatory multi-system syndrome which is in association with COVID. So these children have presented with an immune activation sometime after infection, and obviously in a very small number of cases it has led to the death, but it's still a very rare phenomenon. We've known about a condition called Kawasaki's disease, which is similarly an immune overactivation of your immune system, and that we don't know actually the cause of Kawasaki's disease, but some of the thinking is that it can be triggered by an infection, be it a bacterial infection or a viral infection. What's pleasing is that our paediatric hospitals around Australia work together, and there is a surveillance system being established called the PED surveillance system. They've been undertaking surveillance for Kawasaki's disease and haven't seen any increase, and there's been no reported cases across Australia in relation to this paediatric inflammatory infection. It's also important to note that the countries that are seeing this in their children have very high levels of infection throughout their community, which again highlights the importance of the measures and the important role that every community member has to play in suppressing the level of infection. So we've also released an epidemiological report which will be of interest to the journalist and the community more broadly. But some of the interesting features that I want to just acknowledge to the community. So the time between symptom onset and when people are actually presenting for testing is now 1 day, a median of 1 day. And can I just congratulate the community for that? So going forward, we need that prompt seeking of testing, that prompt isolation, so that people are not out and about when they have symptoms. We're going to need you to wash your hands and have those hygiene messages, but the minimal symptoms is now the time to leave your house, go on public transport, go to workplaces and go to recreation. We also need that social distancing. So this is going to be a partnership going forward with the community. Our ability to control this disease is a shared one, and I just want to say how pleased I am with the response to date in looking at those metrics. We have got those in a very positive place, and I want to keep them there.
Can I just ask, apparently 1.5 million of these rapid test kits that the federal government has purchased may not be usable. There are reports about that today. How concerning is that for the ability to detect this in the community?
So New South Wales is working, our public hospitals and our private laboratories are working very much in partnership. to also get sustained levels of high rates of testing. We have got adequate supplies to meet that 8,000 and beyond target for community level testing. So the issue I think you're referring to is antibody test. So antibody testing is where we test for whether someone's been exposed in the past. It's not useful in finding those cases, and as I said, I want people to come forward with minimal symptoms, and so they will not have had time at that time to develop antibodies. Normally, antibodies develop about 14 days after you get an infection, and it's the body's way of fighting off an infection. I would leave the Commonwealth to comment about the use of those antibody tests, but at the moment our focus is on diagnosing acute cases. We do have access to serology testing, which is the antibody testing, and we use that in special cases, and we also use it in seroprevalence studies where we want to map how we're going in terms of where populations spread. So there's particular uses of the antibody test, but they're not particularly useful at all in diagnosing acute early infections.
Premier, in terms of the government's COVID-19 legislation that was being debated in the Parliament last night, will the government in the lower house accept all of the amendments and recommendations that have been passed in the upper house?
I have to get across what actually happened in the upper house. I understood they sat till the very early hours of the morning, and I'm about to get briefed on that this morning.
But just in terms of your approach, do you think that it would be a good idea to pass?
I understand that most of the amendments, the last update I got at midnight, suggested that most amendments were agreed and done by consensus, and on that basis my assumption is that the lower house is likely to accept all of those. But again, I need to wait till I get across the detail this morning. Yep.
Do you have a roadmap for the resumption of children's sport and activities like Girl Guides, for instance?
We've already started that process. So we've actually looked at every single part of society that's had a restriction placed on it, and then looked at what could the path forward look like for that business or for that industry or for that community organisation. So please know that behind the scenes we're furiously working away with the support of our health experts to look at what is the path forward for all of those things. And at this stage, and we'll continue to adopt this, you look at things which have a low health risk but a very high economic output or uptake, and that's certainly what our focus will continue to be on. And we'll have more to say about that in coming days and weeks.
So when kids go back to school in 2 weeks full time, there's not much chance they can do after school activities connected with school.
Oh look, I don't want to preempt what could be a discussion publicly in the next little while.
Deputy Commissioner, Nathan Cleary the NRL has now determined that Nathan Cleary did leave his home during his TikTok video saga. Are the police now going to fine him for a breach of social distancing? They previously didn't fine him because they determined that he was at home.
There will be some further inquiries made into that over the coming days, and if it's appropriate to take action against that person, that will occur.
Will you speak to him again?
That'll be up to the police. It'll be a local police area command investigation. They handled it previously, and we'll look forward to the outcome of that in the coming days.
Reported that Josh Adokar plans to contest the public health order. What are your thoughts?
That's entirely up to that player as well. Everyone has the opportunity to contest any infringement or court notice that they're supplied with. It's a usual process, and it's entirely up to him, and it's his prerogative to do that.
Minister, sorry, if we can just Northern Beaches Hospital. Obviously, you've built a brand new hospital there. The roads around it, though, what do you say to businesses whose businesses have been impacted by overdue roadworks?
Well, the roadworks actually largely opened a number of months ago. I saw those reports, but the flow is amazing. It's fantastic. So as a local, I love it. And I haven't heard any businesses complaining about it. I think they're actually very happy that it's working very well. I saw the reports in the media, but you'd be surprised to know the reports in the media aren't always as accurate as the facts on the ground.
For a very long time, Minister, there were very severe roadworks around the hospital,
you know what?
And they were overdue. What do you say to
Look, I'm
businesses
just
who were
happy. As a
impacted
local
by
member,
that project?
Sorry, as a local member, I'm delighted that we had the roadworks done, and the community around there are ecstatic about it, so there's nothing more I can add to it. Alex, sorry, Alex.
I mean, we asked the Premier and Dr. Chan, but the Ruby Princess death, for you, I mean, there's been obviously criticism of your role, or at least of you in this. What's your thoughts on this, and I guess the importance of underlining
the issues around anybody passing away on the from the Ruby Princess are extremely sad. The truth of the matter is the cruise industry right around the world had massive issues, and we have a review going on in regard to our particular cruise ship here in New South Wales. There was also another cruise ship in Western Australia that's had some issues. I think that every time someone passes away, every one of us, our hearts bleed for those families. Whether it's your mum or your grandma or your granddad or whoever it be, it's terrible. But I think that in terms of the factors surrounding it, it's much more sensible and logical to leave that to the Commission of Inquiry.
Will you appear or give evidence, or have you been asked to give evidence before that inquiry, Mr Hassel?
James, I haven't been, and as I've said on numerous occasions, one is that the health experts who made the decisions were making them to the best of their ability, and obviously the Commission of Inquiry will get to a conclusion about how all of the various teams work together here in New South Wales. But I haven't been asked, and I wouldn't necessarily expect to be, because I had no part in making any of the decisions. In fact, I was only made aware of the issues 2 days after the event, so I wouldn't expect so. But look, if I'm invited in by the Commissioner, I'd be more than happy to go in and talk to the Commissioner.
One last one with you. The data from the Australian Road Safety Foundation has revealed speeding, using a mobile phone while driving and running a red light has all increased during COVID. We understand that there's been a decrease in crashes, but how concerning is this behaviour, especially as roads now get busier?
It is concerning, there's no doubt about that. It's been something that it'd be fair to say that we didn't expect. With less cars on the road, we would have thought that the behaviour would have continued in terms of crashes being down, but also people not speeding, not drinking and driving, not texting on their mobile phone. But unfortunately that hasn't been the case like you've expressed. We've had a number of operations both in the metropolitan area and in the country area that the results of that are really quite astounding, and that sort of behaviour won't be tolerated. We'll continue with the pressure around that to not only reduce road trauma, to make people realise that just because there's less cars on the road, that their behaviour will be scrutinised, and it's important that people take notice of that.
The murder case.
I just want to commend police for their wonderful work in bringing justice, and for the families it brings closure, for the family and loved ones of the victims, and that's what that's all about. And please know that if you have lost a loved one to crime, that our New South Wales Police Force never gives up, and nor should they. And I'm deeply grateful that the men and women of the force who are part of that team don't give up, because at the end of the day, as tragic as the circumstances are, it brings some level of closure for families and loved ones impacted, and for that we're deeply grateful. Thank you, everybody.
Thanks, guys. Thank you. Thank you very much, Auslan. Thank you very much. Thank you.